Hi, Dr. Stewart here. We are going through our pre-frenectomy protocol. So we do these exercises. We're going to aim to do them for a week, 3 times per day. So the first one is called fat skinny tongue. So you want your tongue to be as flat and fat as possible, 5 seconds, and then kind of go to a point. So ha 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 ha. Ha 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 ha. So you're gonna do that, kind of count to 5, and do that 10 times. The next one is called waggle waggle spot. So the spot, you have a bump behind your front 2 teeth. That is called the incisive canal, or where your nerve comes out on your palate. And that is what we call the spot. So in these exercises, anything that says go to the spot, that's where we're going. So you're going to do corner, corner, spot with your tongue. Ha, 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 ha. And that will be 10 times. So you want to try to keep your jaw like as stationary as possible. The next one is waggle flap. So you're going to try to touch your tongue to your nose and your chin. You know, you may not be able to get very far, and even afterwards you may not be able to get very far, but that's the goal. 10 times. Bite block, tongue pop. So if you don't have like a bite block, you know, you can use a pen cap. You can just try to keep your jaw as stationary as possible, but you're going to try to narrow the tongue and, you know, try to get to like 20. So that is the tongue pops. Cave. So cave, the precursor to that click, you have to suction your tongue to your palate, and that's called a cave hold. I will say some of my patients have a hard time doing a cave, depending on how restricted they are, but the goal is to work up to a 2-minute hold. And you just, you know, trying to relax your neck and shoulders. The next one is just a tongue stretch. So you can grab a paper towel, a gauze, but you're just gonna kind of pull your tongue out and you're gonna move it side to side. And just try to get some more mobility. The next one is called forked fingers. So we're trying to separate the floor of the mouth and the tongue. You know, traditionally when your tongue is tied, the floor of the mouth has to lift, versus when you have that, you know, restriction move more posteriorly, then your tongue can operate on its own without the floor of the mouth having to raise up. So in order to foster that movement, getting the tongue to suction to your palate in a cave and then pushing down with your fingers. So 30, 45 seconds for that one. And then lastly, just some massage. Like sometimes you may get some soreness in your masseter and your jaws, and your, you know, platysma. So just getting some massages in. And as always, highly recommend getting body work pre and post with a craniosacral therapist and or chiropractor with knowledge. So that is our pre-frenectomy AOMT worksheet. So just fill that out, and then we'll see you next week.